Hello, good people. My name is Dasha Kelly Hamilton, and I am joining you to be in a conversation today about that blood work. Now, About That is a conversation that's been inspired by a new piece of art. And over the course of this past year, we've had a range of conversations from aging to entrepreneurship to the Black experience. And we've used fashion and animation and musical theater. And today we're looking at a documentary film called Spilled Milk that takes us into an important dialogue with a special presentation from Versity Blood Center of Wisconsin to have a conversation about the donation of blood and stem cells, and specifically a curious conversation about a curious disease called sickle cell. Now, many of us are loosely aware of what sickle cell is and how it goes, but sickle cell was first discovered in 1910, and we are still searching for a cure. And it's a rare inherited blood disease, and it's something that interferes with how the oxygen moves through a person's body. Now, interestingly enough, more than 100,000 Americans are stricken with this disease, and they manage it throughout the course of their lives. And an overwhelming majority of these patients are Black and brown folks. So we're going to have a conversation with physicians and advocates and patients to get an understanding of some of the misunderstood elements of sickle cell, and to have conversations about how those misunderstandings impacts the quality of the treatment that these patients get. And of course, we're going to lighten it up and have some ideas and get some insights on advancements and progressions that are being made about treatment and advocacy and just different things that we can do. Yes, me and you, about advancing understanding and working even closer towards eradicating this disease. So we are going to do the way every About That begins, is we don't have a panel, because panel just feels like everybody knows what they're talking about, although we do have some incredible experts. But by and large, we're bringing folks, humans, who have worked in this field, lived in this experience, and definitely have an interesting perspective of information and insight. You can get data anywhere, but you know how we have data and still we're trying to figure out this disease? Well, we're going to have a conversation about what we don't think we don't know and everything we do know that we can do. And first, making her way to the screen, I'm going to invite Dr. Dora Clayton Jones to join me. How are you?
Hi, good afternoon, Miss Dasha Kelly Hamilton. Thank you so much for the opportunity to be here.
No, most absolutely. I'm really glad to hear what you have to say. So I'm going to get out of your way off the top. We'll have a chance to chat a little bit more once we get some of your initial thoughts out of the way. But as a conversation starter, I thought how better else to start this whole conversation than with the work that you do. So tell us a little bit about your story.
So I'll just give a brief background about myself. I am the current president of ISCNAPA, that is the International Association of Sickle Cell Nurses and Professional Associates. We have been in existence for 30 years now, and the purpose of the organization is really about advocating for our sickle cell community and really working to improve care from an advocacy standpoint, from a practice and guideline standpoint, and from an education standpoint. In addition to my service role as president of ISCNAPA, I am an assistant professor in the College of Nursing at Marquette University. And so I have the honor and the privilege of teaching nursing students at Marquette University, as well as being engaged with community-based participatory research with the sickle cell community. And so I know there were some areas that you really wanted us to focus in on in terms of our sickle cell community and what I have learned along the way. So I will start there. What I have learned along the way as it relates to sickle cell disease is that our sickle cell warriors are some of the most creative, intelligent, goal-oriented, and resilient individuals that you will ever meet. I've learned a great deal in working with them, and they are very gifted, they are very talented, and I am always inspired spending time with them. I would also add that sickle cell disease is a lifestyle. For them, it is a lifestyle. And so it's not how can sickle cell disease fit into my job or into school, it's how can my school activities and schedule, and how can my work activities and schedule, and how can my social life fit into my sickle cell disease? So it's a lifestyle. And it is something that we are really needed to be allies, to be supporters. They need our support. This is not something that's 24/7, it's 25/8. We need advocacy 25/8. They need our assistance and our support all the time. And so it's not just during September where we have Sickle Cell Awareness Month. It's not just during June 19th when that's when we acknowledge Sickle Cell, World Sickle Cell Day. It's every day of the year, 366, that's 365 plus. So they need us, they need our support, and they need us to create opportunities as much as possible. When I talk about the lifestyle, that sickle cell disease is a lifestyle, when you think about school, students miss anywhere from 20 to 40 days of school in a year because of the sickle cell. Those that are working miss on average 2 to 3 days of work per week. And that's just those that are living with the sickle cell disease in terms of the diagnosis, and their family members are also impacted. Family members are also missing days of school or days of work, depending upon what role they're in at that particular time. I once knew a parent, a dad, who has advanced degrees, who has work experience, but because he wants to be present for his school-age daughter who lives with sickle cell disease, he's not able to work a full-time job. So he works 4 part-time jobs in order to bring the finances in order to bring in the benefits that he needs, and yet still be present for his school-age daughter. And so the sacrifices that people experience and that are put forth are never ending. And so it's important to understand that the lives of those who live with sickle cell disease, and for those that want to be present and support them, is impacted every day.
Excellent. Thank you for that. And that is a lot. And it's one of those things I'm sure that we'll definitely fall into more conversation around how up here we can make a list of anyone with an ongoing condition, the things that would be a challenge. And I definitely want to circle back to how this journey gets forgotten in so many of those conversations. But thank you for kickstarting our conversation around it. So our next guest I'm going to bring to the screen is, please welcome Ms. Tiana Wolford, who's traveling all the way from the East Coast. You had to slide over to that other that tab to make it all the way here.
Right. So much hard work. Wow. So everything that Dr. Jones just said, it really resonated with me. I am a 29-year-old sickle cell warrior, and I have SS hemoglobin, and I can really understand where she's coming from. Like, advocacy really has to be an ongoing thing, and I would say that I probably dedicate 95% of my time to being a sickle cell advocate. And what really jump-started my passion for advocacy came from my experience about 10 years ago. I had a bone marrow transplant, and I was treated on an oncology unit. So that's with all of these cancer patients. And just the VIP treatment that I received on that cancer ward, it was like nothing I'd ever experienced as a sickle cell patient. And, just for instance, I had to do a lot of chemotherapy, and the nurses, they wouldn't even wait for me to feel nauseous. They would run in and treat me with IV Benadryl. And then fast forward a couple of months later, I actually rejected the bone marrow transplant. And so once I was an official sickle cell patient again, even something as small as IV Benadryl that I had been being treated with for a year, I was suddenly told that I couldn't have anymore because I was a sickler and we liked the rush too much. So that was 10 years ago. And unfortunately, as an advocate, there are still so many health disparities that I see. And there's a lot of medical bias and racism that has really trickled down, and that affects our quality of life and our quality of care. And I am getting ready to start my own organization. I'm in the process of starting my own organization. And that comes from my desire to want to eliminate some of these disparities, particularly as it relates to reproductive health and sickle cell. That's something that you really don't hear a lot about. You hear about the pain and the fatigue and all of that, but nobody's really talking about the reproductive health concerns. And what really got me into this specific field of sickle cell was, as a result of my bone marrow transplant, I am now infertile. And so one night I went looking all through Google for some grants that would help me pay for egg freezing. And what I saw was that there was about $1 million for women with cancer and nothing for women who have sickle cell. So I'm starting my own organization, and it's really unfortunate because for a lot of cancer patients, when they undergo their bone marrow transplants, it's written into the protocol that egg freezing and sperm banking is a part of that. But for sickle cell patients, we're not afforded the same opportunity. So that is something that I'm working to address, is really trying to eliminate the disparities that I see in this field.
Oh, my heart is exploding, first of all. With a thank you for that work. So, particularly to be in the throes on some days, but definitely in the journey of your own health maintenance, your own health care, and to be able to still hold space for so many other stories that are probably very similar to yours. So, I thank you for that. Even though the days I know that it's beyond exhausting. But it's definitely enlightening. Something like so many other walks of life, you don't have a way to know that it's something to think about or be
Right.
concerned about until someone takes the time to share their story. So thank you for that. We're going to come back and peel away a little bit more, a few bit more of the whys a little bit later in the discussion. So our next guest who's making her way to the screen is someone who's seen many stories like Tiana's and certainly has been an aid, has been an angel. I would imagine it's been a name that's been shared with her proper name in the same sentence. And she's definitely going to be able to share an interesting longevity of narrative of what this journey is like and what we can do to make it different. So please, we're going to welcome Miss Evelyn Brown to the stage, the virtual stage. How are you?
I'm great. How are you?
I am wonderful. I'm wonderful. Thank you for making the time today.
Thank you all for asking me to participate.
Absolutely. So tell us a little bit, or tell us a bit about just what you've learned along the way and what you wish more people understood about this experience.
Well, my journey started 28 years, 42 now. I retired as a sickle cell disease nurse coordinator from Children's Hospital. And 5 years ago, I retired and I'd worked 28 years. So I have worked with patients from the age of 2 months of age that were diagnosed through newborn screening with sickle cell disease. And my oldest adult that I worked with was 74 years old before she passed. And we worked with patients throughout the whole spectrum. And main thing that I've learned that I would like for people to keep in mind is that sickle cell disease is a very unpredictable disease. It even in the same family, you do not have the individuals experience the same symptoms at the same time. And some symptoms are very mild in some patients, and some have extreme symptoms in the same family. So it's a very unpredictable disease, and people shouldn't be lumped in one category. The most common type of sickle cell disease is sickle cell anemia. And that's a particular disease that usually renders lots and lots of symptoms at various times in people's lives. They can start off as young children feeling well and rarely having complications or crises. And as they get older, same person starts to have lots and lots of problems, which really starts to interfere with their life. And it's great to hear Tiana Woodford to express how she has traveled through this journey, 19 years of having sickle cell disease and then having a transplant. And then a few months later, that transplant to cure her disease did not work. But I encourage people, especially the healthcare professionals, to remember that this disease affects individuals in a different way at different times, and not to lump everybody into the same category. I have work with just hundreds and hundreds of patients of all ages, and their journey is very different. Their tenacity is just tremendous. As Dora Jones has said, their tenacity in navigating themselves through this disease in spite of the healthcare disparities has been tremendous. I've learned a lot from them of how to be strong, how to take adversity and use it as a positive and rather than a negative, and move through this life in a positive way. So I would encourage individuals that are providing healthcare to remember that this is a difficult disease. It's not just difficult for healthcare professionals to help manage. It is very difficult for the individuals going through the disease and their families.
Excellent. Thank you. She said, and that's what I have. No, thank you for that. Thank you for that. And I want to say that it's an interesting point to have to say out loud for healthcare professionals to understand that this is a difficult disease. But as a pedestrian understanding, part of that journey is it is a mystery because it's not something that is, you have a specialty. You specialize in understanding this. So someone who shows up in an emergency room or comes to a general practitioner, there is a huge gap between a general understanding and what a sickle cell patient typically is going to need. So that grace, in addition to information, is a huge learning barrier, or maybe a conversation invitation that can happen in the field. So thank you for reminding us that there's a huge part of what we need to talk about.
Thank you.
You're welcome. So our next voice that's going to come to kick off this part of the conversation. And again, if you have commentary, if you have questions, please add them to the chat thread, whether you are joining us on Facebook or on YouTube. When you're able to put your comment or even a heart emoji, we're able to involve your questions and commentary into the discussion. So just know we'll have a chance to address your questions, because we know that these are not the only 4 living experiences or volumes of wisdom that are going to help this conversation. So our next guest to the screen is Nicole Badura. Nicole, joining me. How are you?
I'm great, thank you. Thank you so much for having me on today.
Absolutely. So we're glad that Versity was able to invite us to be a part of pulling this conversation together. So there's nothing like having an expert pull together some experts to have an expert conversation about what folks can do better. So tell us a little bit about what you understand about what folks can better understand about sickle cell.
Yeah, so first of all, I don't feel like an expert at all in this after hearing the other 3 speak. So I feel really blessed to be a part of this conversation, and I'm learning so much too. So yes, I work for Versity. I'm a part of the Be the Match program, and Be the Match is the stem cell donor registry. You did mention earlier on searching for a cure for sickle cell, and there is actually a cure for sickle cell. That is a stem cell or bone marrow transplant. Tiana talked about that she had a bone marrow transplant as a part of her path, and unfortunately it didn't work for her. She had a transplant. Her donor was her mother. So her mom was only a half match. There was no match for her on the registry. And that could have changed the outcome of her story if there had been a match on the registry for her. Only 20% of patients have a match in their family. And the remainder of those patients do rely on Be the Match to be able to find that match for the transplant. So we definitely work with sickle cell patients, but we do also work with cancer patients as well. There's 76 different diseases that can be cured by a stem cell or bone marrow transplant, which is pretty incredible if you think about it. So my job really is raising awareness, education, helping people overcome those myths about being a stem cell or bone marrow donor, helping people get over that fear. And really in my job, I've learned so much about that dark history of medical experimentation that African American and Black people have experienced in the past, and how those fears have been passed on from generation to generation, and they're really real. So when people think about going on a registry where they might be asked to donate stem cells or bone marrow, or they're asked to donate blood, they're still scared. And so helping them overcome that and really earn that trust, gain that trust, and really work on that education aspect of it. So that's a really huge part of my job. Letting people know that if you sign up on the Be the Match registry to be a donor, it's actually a really simple process. Donating stem cells is a lot like donating blood or platelets. And after hearing stories from patients like Tiana and all of the things that she's gone through in her life, all the pain she's had, knowing that your little bit of inconvenience to be a stem cell donor is so much worth it, knowing that you're potentially saving someone's life. So just teaching people about that is really huge.
Excellent. Thank you for that. I would say in a very different context, the people who work at the IRS have a job to do. None of us want to see them coming. Yeah.
Exactly.
So, but I definitely took note of, and we'll have want to bring this back in the conversation we're all together, is the historical reality of a very, like you mentioned, a troubled relationship between Black and brown folks and medical research, medical requests that require some kind of invasion into our bodies. Historically, it hasn't always gone well ethically or justly. So knowing that that's part of the conversation that you have to face when talking to folks about how folks can be involved in a solution. So understanding, so what are those, and not talking points that make people feel better about what they're nervous about, but really addressing the things that people are concerned about with some information. So I'll be really interested to hear how some of those conversations have gone, and how some of the folks who are joining us today can have some of their questions answered about, but what about that Henrietta Lacks though? Because these are real things that have happened, right?
Exactly.
Most definitely. So what I would like to do at this point, like I mentioned, these about that's our opportunity to do a couple of things. We have a full conversation about something that is of interest or affecting so many of us, just getting up and living every day. And it's a chance to introduce some of us to situations or conversations that we may only enter from a very slanted, biased view. Guess what? You're human. That's how bias works. You have your lane and your perspective and the people and scenery that you see every day. That's going to shape how you think and the things that are of importance to you. So this is a reminder that there is more out there for us to at least be aware of. So, and art gives us an opportunity to do all of that. So it can give you a chance to learn a thing. And what I love about art, all of the art forms, is it introduces information to all of our human senses. So you're also going to have a chance to feel the why of the information. So I'm going to super quick, and by super quick, I'm saying I'm gonna do something fancy on the internet. It's not fancy at all, but we've all had a Zoom hiccup, is all I'm saying. So I would like to share the trailer of this documentary, Spilled Milk, which all of our guests have had a chance to look at, and we're going to come back with all of our questions. So the questions from the things that they've shared, I know I have a few of my own, and then certainly for those of you that are viewing, this clip is going to introduce some new questions and considerations for you as well.
I'm not Jakai Mickelson.
And I'm not Omar Beach.
But we are each other.
What? Yep. We've been friends for a really long time, and now we're in front of you because we're working on a documentary.
About something quite personal.
Omar's dealing with a disease that not a lot of people know a lot about, or at least that's been my experience in telling people about Omar's disease.
I was born with sickle cell anemia. It's a blood disease, and it has a lot of complications.
Throughout Omar's life, he's had to take a lot of pain-managing medication because sickle cell hurts a lot.
And I want to make this movie so that the people in the medical field can understand that.
And something that I've actually learned within the process of working on this film is that there's a pretty brutal stigma attached to it.
Because it's a very African-American heavy population. It's not out there that much. Most people don't know about it. And that's fine until it starts affecting treatment.
The first shoot for this film was in November of 2012. This has been a super small, intimate, kind of guerrilla type film. It's been me, Omar, and a couple cameras. We've hired crew here and there, but mostly it's been us. It's all been self-funded. Equipment.
This guy's been bankrolling the whole thing, basically.
Equipment, travel, everything related to it has been out of pocket. We've captured over 60 hours of footage. We're to a point now where we've got so much accomplished, but we'd really like to raise the money to help us with finishing costs, mastering, color correction, editing, basically all the post-production. We've got an original score that's going to be worked on by James J. LaRue. We want this film to be as good and as impactful as it can possibly be, and my bank account just isn't enough to make that happen. So now we're looking to you, the interwebs, to help us meet our goal. Sorry for calling you an interweb just now.
So that we can make the best movie we can make, because a good movie is going to have more impact.
All the things, all of the things. So I have a lot of questions, and that's as someone who has, like I mentioned, I call it a pedestrian understanding of sickle cell. And even in this conversation today, learned that there are different kinds, that sickle cell anemia is not the only sickle cell. So thank you already for expanding what I thought I knew. And I think that's the case for many of us. So in watching this documentary, I'm going back to something that you mentioned about how this impacts the care. So there's the perception of who and how and why. You show up, Tiana, as an example, in a state. It speaks to how much education that you have to give your peers to help care for patients that you all are supposed to be caring for in the same way. And similarly, it impacts how the public shrugs off or doesn't shrug off the work that you're doing. So you did such an incredible job, all of you, of getting us into this conversation. So I just want to invite you to keep going. So the questions that you have for each other, what you got from spilled milk, and what it offered you in conversation with folks about what we should do next or do differently.
While I was watching that, I got a little teary because I don't know if everyone knows this, but Omar has since passed away. And it just made me think, because seriously, in this community, we're pretty close-knit and we have a large social media presence. So it's like everybody knows everybody. And since June, I personally know of 22 sickle cell warriors, adult warriors, who lost their lives. And just when I think about that, it hurts. And for as much as all of us up here are doing to advocate for, effective change in this space, we can't do it alone. It's really going to take everyone. And just when I think about the journey of an adult sickle cell patient, it's tough because we already don't have a lot of providers who provide adult care for sickle cell patients. And I think a lot of that has to do with the fact that there's no money in sickle cell. A lot of the doctors, I've spoken at medical schools, and they admit to me there's no money. They would rather go to cardiology, but there's no money in sickle cell. So, and even when I think about that transition age, like we lose a lot of people as they transition from pediatric care to adult care. And one of the things that I'm excited about is the fact that we do have new FDA approved therapies, and there are so many coming down the pipeline. And I'm just hopeful that these new medications will make it easier to manage sickle cell, and that, some years from now, we won't have to be losing so many adult warriors to this disease.
And when and I imagine it works in both directions. When you say losing them as their lives, or losing them also in this in advocacy work?
I was talking about more so losing them as far as like mortality, losing their lives, but that's another conversation, I guess, is losing them in this advocacy space as well.
Okay. Thank you for that. I think, Dr. Dory, you were going to say something?
I was just going to add, that's one of the areas that I look at, because I look at healthcare transition of our pediatric population as they move to adult care. And the statistics are real. It's something about that young adult period where, as Tiana mentioned, the mortality rate increases by about threefold. And so to understand what is going on, there's so much context there. We certainly can't do it all in the next few minutes, but there's a lot of context there about the lived experience of a young adult, their lived experience and what they deal with on a day-to-day basis. If we think about the African American population and what we deal with as it relates to systemic racism, that's multiplied for the individual that's living with sickle cell disease. So I would say we don't want to stop our efforts in addressing systemic racism and injustices. We want to continue that, and we want to get more specific when we're talking about our sickle cell population and their lived experience and what they face when they arrive at the emergency room and what they face when they avoid the emergency room because they don't want to be treated in a certain way. They don't want to be placed in a category as being a drug seeker. They don't want to be treated disrespectfully. It happens, and it's something that we want to bring awareness of, not just locally, but nationally. This is something that happens, and I know that there are teams that are working on that. I'm working on it as well with individuals and working with coalitions and consortiums and ISCNAPA, but it's something that we need to discuss, and it's something that we need to bring to the table and have an action plan.
Is it more a matter of expanding the conversation, like just getting more pockets of people to have it, or is there a denial that it's something that needs to be discussed?
I would say there's a combination. And thank you for bringing that up. I think there's a combination of we're not talking about it enough, and we need to talk about it in every circle. Our service organizations, we need to talk about it. Our healthcare organizations, we need to talk about it. In the media, we need to talk about it. In academia and scholarship, we need to talk about it. And in business arenas, we need to talk about it. In every level that you can think of, in every, all of these circles, we need to have ongoing conversations, and we need to talk about how each of these entities can have a role in developing an action plan for supporting our sickle cell community. I also believe that people are in denial. Oh no, I thought sickle cell was cured. While we have certainly made advancements as it relates to gene therapy, bone marrow transplant, we're continuing to make advancements in developing a cure or making those cures that are current more widely available. We still have work to do, and not just on the research aspect, the medical aspect, on the psychosocial aspect, on the reversing and erasing stigma aspect. And so I'm pulling up my sleeves right now because as I'm talking, it's like, okay, I will be working for the rest of this is what I'm going to do for the rest of my life, and I'm good with that. Whether the money is there or not, and Tiana, you mentioned the differences between monies that are allocated for cancer research or for other diagnoses in comparison to sickle cell, looking for funding for having your eggs harvested in that. There's discrepancies, there's disparities there. And so working to advance health equity across those different aspects and areas is very much needed. Whether the money is there or not, as I said, whether I have research dollars or not, whether I have money for working with the community or not, I am committed to making a difference.
Thank you for that. There's a question that we have that came through the line that's kind of melds with something I'm curious about as well. They want to know this. It seems that mental health is a major concern for young adults and adults living with sickle cell. How is this being addressed, and what more can you do, and what more do you feel should be done? So what has been some things that you've experienced that have been helpful? Yes, please.
Well, this is I'm really glad that this came up because I can't tell you guys the number of calls that I get from mothers, spouses who are so concerned about the sickle cell warrior and depression and anxiety and PTSD. And that's actually, I'm in school now, and I am a psychology major, and I plan to pursue my degree in clinical psychology. And part of the reason is because I've seen the mental toll that this disease can take. And I know, looking back to like my middle school and my high school years, I had so many pain crises, and we know that stress is a trigger for those. And seriously, when I look back, I believe that the majority of the crisis that I had back then was brought on by stress. And so having this opportunity to talk about what could be done better and what could be done differently, I wish that we would start early addressing mental health, and that there would be mental health specialists involved even from that pediatric stage, because this is a chronic illness. It is something that, unless you do pursue a curative therapy, you will be living with. And so I feel like if we can do a better job at addressing mental health from an earlier age, a lot of us would live better quality of lives. And something that I've seen as an advocate, and something that I've done myself, there's this natural reaction to kind of want to isolate and go into yourself, because I think a lot of it has to do with the fact that you compare yourselves to your peers and what they're doing. And sometimes you can't keep up, and that causes depression, and it's easier to just want to isolate. And I think that's one of the worst things that you can do. And that's another thing that I'm working on doing, is starting like a mentorship program / support group, just so that we can get together and share our lived experiences and talk it out, because that's something that really helps me, is just being able to talk and vent. And I think a lot of us would benefit more if we talked rather than suffer in silence.
And suffering in silence has all the things we're figuring out. Suffering in silence doesn't work, and working at 195% is also not the best way. Although we were told other things at once upon a time. And I'd be curious to hear from the family end of things. Miss Evelyn, having worked with, you said, hundreds and hundreds of families who are attached to these patients, what advice have you seen, or what have been some best practices for families to maintain their spirits and be supportive?
Yeah, it's definitely a difficult area. But when I said I learned a lot from a lot of the sickle cell families, parents as well as the adults, they just learn how to still be a family and present themselves as a unit trying to work together to go get through this disease. Many of the children really felt like their parents were on their side, and they were always working on their behalf. And there were always a few that weren't. But overall, the parents were just so helpful in trying to make sure they would talk to the teachers at school, try to figure out what else can we do to get the homework to the children, what else can I be doing in order to bridge the gap where my child has to be in the hospital a long time. Young adults trying to find jobs where they have employers that are at least willing to work with them so they can maintain their jobs. But it's a very, very difficult process, and it's an ongoing discussion. Even as I retired 5 years ago, I'm still hearing as much about it now as I did when I was working 28 years with the sickle cell program at Children's Hospital. But it's something you have to keep working at. It's very difficult, but you have to keep plugging away. And as Dora was saying, and Tiana, you have to have individuals that do this job or work with sickle cell patients because they want to see someone improve their quality of life and live longer. Mm-hmm. And sometimes the money is just not going to be there. And I don't know when that reality will change, but it's in my lifetime, probably not. But I know it's something we have to keep working at. But I just hope that there are more individuals looking at the desire of trying to practice their craft to make sure people have a better quality of life. And that's all people. And that's, as we know, that's our universal type of experience, and our desire is to see that all people get treated fairly.
Okay. That makes a lot of sense. You said something that kind of speaks to something that Dr. Dora said, and we also have here a comment from Michelle Wake, that it takes takes a community for us to stay in this conversation, and more than just talking out and around things, there are things that we can do. So definitely going to we're going to close out with information about how to make blood and stem cell donations. But you said something about, and there's something in the documentary where you had this young brother who's like, I can't keep a job. And not because I'm not willing to keep a job, not because I don't have the ethics to keep a job, not because I don't have the desire to keep a job, I'm sick. You know, we have an episode that's unpredictable, and, you know, you mentioned to find career positions, job positions, employers, partners who can work in a particular grace that's definitely going to exceed whatever the sick days are, whatever vacation time is. So that's something employers can do. So I'd imagine it's something that schools can do. So just some other ideas and things that you've seen. Again, if you don't have a loved one or yourself who's processing this, you don't know how we might be able to be a better part of the machine. So where are some other areas that people can be helpful, from employers to partners to teachers? What are some things that you've seen, some best practices that we all could consider?
So I can add a little bit in that area as well. So I have partnered with World Outreach Center in conducting community-based participatory research. And in doing that, one of the projects that we piloted was a support group. And that because of COVID-19, that support group had to go to a virtual platform. And it just so happens that that virtual platform it ended up being very successful. Thankfully for the contributions of our sickle cell warriors, they gave input, they gave feedback. That we talked about, you know, what would be realistic to discuss and what resources we could provide virtually. And so doing that in partnership with World Outreach, the professionals that participated, Thomasina Jenkins, who is a clinical mental health professional, she supported that online virtual support group, and then Kim Turner, who's a registered dietitian. So being able to tap into those resources within a faith-based organization in partnership, we were able to partner with them, and we were able to mutually support one another as well as support the sickle cell community. So being creative, looking at partnerships within the community, academic and faith-based organization is what that partnership consisted of. And then we talked about employers, allowing some grace, really getting very detailed and having a plan. If you have someone who's a sickle cell warrior that's employed by your organization, really having a plan on how they can still continue with their benefits and their financing, receiving finances on the days when they're not feeling well. What could be a work plan for them? Being very specific and being very detailed in order to support them, because there will be days where they just will not feel like doing the work. Can they work from home? We have sickle cell warriors who have been frontline workers who have had to quit their job because of COVID-19. And that's it's another whole conversation, but they've lost work and benefits because of COVID-19 and not wanting to put themselves at risk. And then we have parents who are frontline workers who have had to quit their jobs because they don't want to put their children at risk. So there's a lot of conversations to be held, but, looking at how can employers support, how can business support. For ISCNAPA, we award scholarships to students. And I will say, we give 3 to 5, scholarships a year. And that's for sickle cell warriors across the nation. We would love to be able to give more than that. It's not that they aren't qualified. There's so many qualified applicants that we can't award scholarships to them. And so there's many things that people can do from a funding perspective, from a workforce perspective, and providing opportunities and being creative around working and supporting and providing establishing partnerships within the community.
Okay, that's helpful. And there's also just a basic understanding. informing ourselves, because you're going to have that cousin, you're going to have a friend of a friend, there's going to be an employee, employer, a coworker that's going to give us an opportunity or challenge us to learn these things on the fly. And in many cases, we're going against, again, assumptions. So I want to get some insight on some of the misinformation that keeps people from being as supportive as they can, keeps people from being as healthy as they can for themselves. In the documentary, there was the main character, one of Omar's comments was, about that great diet, I need joy also. So there's managing, he said that people there's a distance between managing pain and managing your disease. He goes, pain is not a feeling. Pain is a thing. So I can still be happy and be in an incredible amount of pain. I can still have these other emotions. It's not a mood. It is something that I deal with. So what is something on a people's level of understanding that, in kind of getting to the closing, you want people to remember or think about as we move forward in new treatment, understand, making an effort to be more understanding and open and inclusive? And then what can we do? And I'm definitely going to get to you, Nicole, to talk about how we can do our donations. So each of you, what's one thing, an appeal that you want us to all understand? Because it starts up here. It starts up here.
Right. So for me, I would want people to understand that the pain that sickle cell warriors go through, that we experience, is real, because that's one of the things that we fight against as far as stigma and misconception. It's like a lot of us have really high pain tolerances. So if you see us in the emergency room and we say we're at a 9 out of 10 pain, we mean that. But because we're not screaming and hollering and crying, a lot of times the doctors will look at us and say, you're not really in that much pain. Or there's like this stigma that we're drug seekers or we're just lazy. And it's like, no, truthfully speaking, like Dr. Jones was saying, we would rather be anywhere else but the emergency room or the hospital doing something productive and, not having our dignity compromised. So that's my biggest thing. I just want people to understand that these stigmas, we have to put an end to them. And then we have to go beyond that too, because a lot of times even healthcare providers, they will sum up the sickle cell experience to just pain. And we know that's one of the hallmarks of sickle cell, but there's so much. Sickle cell really affects every aspect of one's life and the family's life. And so we also have to start taking more holistic approaches to sickle cell care.
That's true. And I want to say there's a little footnote. That's a footnote for all of us and all of our care and all the ways that we breathe, be more holistic in how we care for ourselves. But thank you, that stigma and something that we don't know and assumptions that we make, which don't always make any sense. So that's something we want people to know. What is something else from Dr. Evelyn, Dr. Dora, Ms. Evelyn, that you want people to, just one thing you want them to get? What do you want them to understand about what we're dealing with?
I just want to reiterate that it's very difficult with this disease when you have a lot of patients and you want to lump them all into one category. Try to individualize, look at the individual that you're dealing with, not think that because Evelyn may have come in and not really been in pain, like she said, and she was trying to seek drugs. Tiana is coming in as a different person. She's not Evelyn. So look at her as an individual who deserves a better chance of dealing with her one-on-one rather than having our preconceptions of this disease. And that's what I've seen a lot in 28 years that I've worked with the sickle cell program. That was one big thing that the other nurse, named Gwen, and I worked so hard in trying to dispel the lumping everyone in one category. And it does take a village to help understand this disease. And I think if you're having anyone in your family who has any form of this sickle cell disease, you just try to learn more and more about the disease, to really try to be very helpful and try not to make assumptions, even though, like Tiana said, you can't see the pain and the severity of the pain. The individual has dealt with this so many years, the body learns how to cope with it. Acute pain, which is pain that comes on without any warning, but something you've never had before, most times a person's body's going to respond by crying and screaming and getting in a ball of, balling yourself up in a ball. But when you've had a chronic type pain like this for years, and as Tiana said, it's the hallmark of sickle cell disease. Most frequent complication is painful episodes. So an individual the body is going to respond differently over time. So don't at least try to understand that whatever I see is not what really is. And if you can do that, you can really try to help a person help them get through. And the village has to be there to help them make each step of this journey in order for any success. And it's just, as Dora said, the mental health, the emotional, the finances, all this has to come together. We have to figure out some kind of way to keep working at it. It's a problem that can be solved. Yes, it may be difficult, it may be huge, but it can be solved with the interaction of all the disciplines working together as one unit to help these individuals, sickle cell warriors, to have a quality of life that they deserve.
Most excellent. Thank you for that. It's reminding me that basic knowledge is, even all of your reading and knowing and whatnot, you're not in that person's body. So give them the space to tell you what's happening with their body. Dr. Dora, what do you want people to get? They don't get nothing else.
Yes, I think that an important takeaway is that pain is what we learn in nursing school and what we teach our nursing students. Pain is whatever the person says it is whenever they say it's happening. And so I cannot tell Tiana or anyone else that, no, you're not experiencing pain. Oh, it can't be that bad. And as she commented, coming in the emergency room, being, being not as, not screaming and kicking and hollering, the person may think they're not in pain. And perhaps they're saying, well, if I kick and I scream and I holler, then they're going to call me a drug seeker. So you're caught in between these two presentations of what people may do when they're experiencing pain and not quite sure which one should I be? Should I be quiet about it, or should I be kicking and screaming so that I get the help and then deal with possibly being, called a drug seeker? So pain is what the person says it is, and the pain should be addressed. A fact about pain in sickle cell, the longer that someone is experiencing pain, and when I'm talking about unnecessarily, meaning that they could have gotten relief, the longer that they're experiencing pain, that decreases their life expectancy. So it's a social injustice for someone to be experiencing pain and they don't need to be experiencing it. When they're arriving in the emergency room, they should be treated within a half an hour. They should not be waiting for hours to be treated. There should be a plan, and that plan should be enforced, and their pain should be addressed. And so we want to make sure that we're addressing pain because we want to improve quality of life. We want to improve the life expectancy for our sickle cell community. And I would say advocacy. Advocacy is critical. You do not have to be a healthcare provider to be an advocate. Anyone can be an advocate. And one thing that I learned when I first began working as a pediatric nurse, there was a sickle cell patient and he was a preschooler. And if he can be an advocate for himself at the age of 4, certainly I can advocate for the sickle cell community. We all can advocate for the sickle cell community. Whether you know a warrior or not, get to know warriors. Check on your warriors. And ask questions about sickle cell so that we are informed. Don't let a question go unanswered. You can email me, and I'm sure other people that are sharing here, you can contact them, but you can email me, dora.clayton-jones@marquette.edu. Our organization, IASCNAPA, that's IASCNAPA.org. And so you can send your questions that you may have, your ideas. We want to hear from you, but anyone can be an advocate, and I would encourage you to rise up as advocates. We need you. Our sickle cell community needs you.
Oh, it's excellent. Thank you for that. Thank you for that. Oh, my whole heart's about to explode. So anyone can be an advocate. And that is the whole see something, say something. It's asking questions. It's finding a way to be a resource for people that you may know in your circle. And there, of course, is giving the goods. So please, Nicole, tell us a bit about the next steps and how people can get in line, and even in times that we're in now, how can we physically join the team and join the fight?
Yeah, so not all sickle cell patients are eligible for a transplant, that we know, but 1 in 5 that are eligible won't have a match. So joining the registry is really easy. It's just a quick online form, and then you get a cheek swab that comes right to your house in the mail. So we just take cells from your cheek. There's no donation at that time. And then after filling out that online form, you're doing your swab, you're then added to our registry. And then at any point in time, until the age of 61, you could be called as a match for a patient to donate stem cells. So this would be a patient with sickle cell, if you match a patient that has sickle cell, or potentially a cancer patient as well. Like I mentioned before, all those other diseases that can be treated. If you do get called to donate, you donate stem cells in a process that's very similar to donating blood or platelets. If you're asked to donate bone marrow, not as scary as people think. We don't drill into your bones. We don't cut into your bones. It is a surgical procedure. You're under general anesthesia, and it's an outpatient procedure. So you don't feel any pain during the procedure. It's just a small injection in the back of the hip where we remove the marrow that then goes to that patient who is in need that you've matched. Lasting effects of that, I hear most of my donors say the lasting effect is that they've helped save someone's life, which is really powerful. Most donors are back to normal within just a couple of days or so, so it's a much easier process. Hearing these warrior stories and everything that they go through, the pain that they feel on a day-to-day basis, like I said before, it's worth it knowing. So you can actually follow my Instagram page. It's BeTheMatch_Wisconsin. And the link to register is right on there. Also, if you do go to versity.org, you can search Be the Match, and our link is there as well to join the registry. Like I said, just a couple of minutes, online registration form, and then a cheek swab come right to your house in the mail. It's pretty easy.
Excellent. Wonderful. Thank you. Thank you. Thank you. I want to close out with a comment that's come in. We're all over the internet. They're coming in different places. And this is from Sister Stephanie Zolokoffer, who said, "My dad lived to be 71 years old with sickle cell. It was hell, but I'm thankful that we had him that long because she also had a cousin that she lost at 25. So we have a range of narratives, and there's like so many other things in our world. You never know who you never know who you never know. So we are all encouraged to be advocates. We are all encouraged to continue asking questions. We definitely invite you to consider giving the ultimate gift and going to versity.org to become a registrant, to donate blood, donate stem cells, and to become their volunteer team. Even if you're able to make phone calls and lift somebody's day, you never know what they need. And if we are available, and we are indeed a village, this is a uniquely urgent conversation we need more of our villagers to be a part of. Thank all of you for making time out of your afternoon today to be able to share with us all of your insight and your experience. Thank you for the work that you're doing. And we are also appreciative to have been invited to be a part of coordinating this discussion with the Versity Blood Center of Wisconsin. And we're going to be back again on Thursday for another conversation about an incredible gift. We're going to have you donate some more of your body parts. But no, we're going to have a conversation specifically about the impact of organ donation with a special poem-a-log series. So those of you that follow along know it's conversation, a little poetry mixed in, but definitely just like you all have done here, it's sharing huge bits of you with those of us who can definitely appreciate learning and loving a little bit harder and more. So have an incredible evening. Thank you for the work you're all doing. All of you, go to versity.org, register to make sure you become a donor, a giver. And if you have any other comments, now's the time to drop them in the chat. Closing questions. It's like that meeting, like that you don't want anybody to come up and have we don't need them praise, no altar call. Fantastic. Have an amazing afternoon, everyone. Thank you.
Bye.
Thank you.